There are so many diets out there, it can be overwhelming and confusing. And most of my patients who come to me for the treatment of obesity have tried nearly all of them. And today I want to go over some of the most popular diets and talk about the pros and cons of them and really highlight which ones I recommend and which ones I don't. My name is Dr. Lindsay Ogle, and I'm a board certified family medicine and obesity medicine physician. And I help my patients achieve and maintain a healthy weight for them to help improve and prevent weight related conditions. And I help them optimize their lifestyle, and I utilize safe and effective medications when appropriate. But even when I use medications for patients, we are always fine tuning our nutrition and our lifestyle. And I will say just right up front, there is not one diet that I recommend. And it is because everybody has their own preferences and their own tolerance and their own lifestyle and health conditions that will impact how they respond to different diets and what they need out of a diet. And so I am not a one size fits all person. I am not handing people a nutrition plan. We are working together to find what works for them. But first, let's talk about why most diets fail in general. And it is not because of lack of willpower. It is not because any fault of the person following that diet. It is because of a combination of biology and our environment. Biologically, when we are in a calorie deficit, which is required to lose weight, your body responds to that by increasing hunger hormones like ghrelin and decreasing your metabolism because it thinks that it's helping you. Evolutionarily, when we were not getting enough calories, that meant that we were in danger, that we were starving, and the body was created to hold on to our extra energy stores, our extra calories, to save them for a time when that might be the case, when food was not available. But in our modern world, food is readily available for most of us, and we don't need that mechanism anymore, but that is what we are working with right now with our biology. And so when we diet and we reduce our caloric intake, we're exercising more, and we're losing weight, the hunger hormones go up and metabolism goes down, and that sets people up to eventually regain their weight because it's truly impossible to maintain long term, especially in our modern environment when we are fighting against marketing of all of these foods, both healthy and unhealthy. And we have truly food scientists who are creating foods that are more palatable, and most of them have more calories than typical. They're calorically dense, and so we are getting more calories per food that we're taking in compared to previously. There are other things at play rather than just calories in versus calories out that lead to weight gain or weight loss. There is also our genetics and our epigenetics. This is not something that we can control. We are born with this, and this is based on our ancestors, and then also things that we were exposed to when we were in utero, when we were just in our mom's bodies and growing that way. There's also influence on hormones. So, most notably insulin, but also cortisol and estrogen. There's also influence on endocrine disruptors. So, those are things in the environment like microplastics and pollutants in the air. Also, body composition. So, the more muscle mass we have, the higher our metabolism is at rest. So that plays a role. Our sex assigned at birth. So men tend to have more muscle mass and have a higher resting metabolism than women tend to. medications that we're taking can either promote weight gain or lead to weight loss. And surgeries that we've had in the past, anatomic differences, as well as other medical conditions, can change whether we are prone to weight gain or weight loss. So there is so much more than calories at play, but calories are an important part. So diets do work, but only short term. As I mentioned in the very beginning, most patients who come and see me at Missouri Metabolic Health and they're looking for help with weight management, they have tried almost every diet available. So let's review some diets that claim to help with weight loss, but really ultimately don't. First, we'll start with intermittent fasting. This one was extremely popular over the last couple of years. I don't hear it talked about as much anymore, but intermittent fasting really claims to help with weight loss by reducing insulin. And reducing insulin is helpful for weight management because insulin tells our body to hold on to energy. So when we have high levels of insulin, it is very difficult, if not impossible, to lose weight. So if you are intermittent fasting, then that gives your body a chance to lower insulin levels during that fast period and release energy and release stored fat. The problem with intermittent fasting is if you, especially if you do prolonged fasting, that you are truly hungry when your time fast is over. And so many people then overeat when it is time for them to eat in their eating window, it's often called. And when you're really hungry, and especially if it's later in the day and you're tired and overworked, you're going to reach for foods that are very easy, satisfying, and give your brain a lot of dopamine. So if this is you, if you notice that pattern when you've done intermittent fasting, I do not recommend this diet because you are not going to be feeding your body healthy nutrients and you're going to start a binge eating cycle. That also is a good reminder that intermittent fasting is not a good idea for anybody who has a history of an eating disorder, especially binge eating disorder, because this is going to perpetuate the cycle. Intermittent fasting can mean a lot of things to different people. It could be a multi-day fast, or it could be even eating in a 12-hour window. But typically I hear people referring to a 14 or a 16, sometimes 18-hour fast, and then eating in the remaining window of the day. I think it's very reasonable to do a 12-hour fast. That counts. I mean, many people don't consider that intermittent fasting, but I think can be really helpful for most people and reasonable for most lifestyles. But ultimately, I think what can be extremely beneficial, and this is something that I noticed personally in my life, is even just cutting out snacking can be really powerful to give your body that time in between meals for insulin levels to lower. So to me, a compromise for intermittent fasting could be cutting out snacks and eating within a 12-hour window. Some people may benefit from longer fasts, and that is okay if it works for you, but this intermittent fasting does not guarantee that you're going to lose weight. Kind of on the flip side of intermittent fasting is intuitive eating. And intuitive eating is when you listen to your body's hunger cues and eat when hungry and stop eating when full. And this theoretically sounds wonderful and I think would be perfect for us to follow. The problem is when somebody is dealing with the disease of obesity, or they have disordered eating patterns or emotional eating, this can set somebody up for failure because, like I talked about earlier, with our biology, our ghrelin levels, our hunger hormone could be artificially high. And so if we're going off of that, then we are going to be overeating. So intuitive eating, again, in theory, sounds great, But for many people who have been struggling with their weight and chronic dieting, it's not ideal. I do think having some structure around your nutrition, if your goal is weight management and improving your metabolic health, having a nutrition plan can be beneficial. Another extremely popular diet is the ketogenic diet. Again, this seemed to be more popular a few years ago. I think the expansion of GLP-1 medications has in some ways made the ketogenic diet less desirable or, for some people even obsolete. The ketogenic diet is actually one that has a little bit more evidence behind it to actually decrease hunger levels and lead to modest weight loss. This would be more on the level of a couple percentage of total body weight. And for many people, it can even reverse their prediabetes or diabetes or put it into remission. It can also help improve cholesterol levels for some people, especially increasing HDL, the healthy cholesterol, and decreasing triglycerides, which are our free fatty acids in the body. But for some people, it can increase their cholesterol. So this is something to take a look at with your doctor if you decide to try a ketogenic diet. So there is, some good evidence for metabolic benefit, but it's extremely difficult for most people to maintain long term. And I should have said this in the beginning, and I kind of alluded to it, but diets will only work if you sustain it long term. If you do follow a diet for a couple of weeks or a couple of months and you get positive benefits, but then you go back to how you were eating before, the weight is going to come back on, or the health conditions that were managed with that nutrition plan are going to return or be less controlled. So we are always looking for a nutrition plan that you are able to maintain long term. And for many people, not everybody, because I do have patients who do a ketogenic diet and do wonderful on it, but many people, this is not sustainable long term. And therefore, I don't tend to recommend it, but it could be an option. The opposite of that is a low-fat diet, which was popular in the 90s, and there were so many low-fat options of snacks and low-fat yogurt and low-fat ice creams and lots of different desserts that were available that were in low-fat version. The problem with the low-fat diet, I will say, it was created because the thought process was that that was going to help prevent cardiovascular disease. Unfortunately, that is not the case, and cardiovascular disease has continued to rise in occurrence and incidence and is the number one cause of death for both men and women. The reason I think this is happening is because if you are lowering fat, typically you are increasing your carbohydrate intake, specifically added sugars. And we know that added sugar has a negative impact on metabolic health, weight management. It can increase your insulin levels, and that can cause inflammation in your body, and that can increase your risk of cardiovascular disease and many other chronic conditions. So low-fat diets, I don't recommend. It typically also leads to a lot of hunger because fat in our diet helps to satiate us. It helps to have us feel full and to maintain that fullness in between meals. So I don't see low-fat diets being a great option. I see that as the 90s diet culture, and it should stay in the 90s. Next is vegetarian or vegan diets. Now, this can be a wonderful option if you want to be vegan or vegetarian for animal justice reasons or environmental reasons. And if done right, it can be very healthy. It can be a very healthy diet, but it needs to be done right. You can be vegan and only eat Oreos and rice and high carbohydrate, high calorie food with not a lot of nutrients in it. When done right, it will look like lots of fruits and vegetables, nuts, seeds, legumes, whole grains. And I have a colleague, Dr. Shayla Toombs Withers, who is an obesity medicine physician and a lifestyle physician. And she has a podcast that helps people to live a plant forward lifestyle. And I will link that below if you are somebody who is interested in a vegetarian or vegan diet, because she will help guide you to do this in a healthful way. But just because you follow a vegetarian or vegan diet does not by any means mean that you are going to have weight loss, and some people may even gain weight on these diets. Gluten-free diets are fairly popular, especially in should I say, the alternative medicine world. Gluten gets blamed for a lot of things. The truth is, the only people who really need to avoid gluten are people who have celiac disease, and that can be tested for with blood tests, stool tests, colonoscopy. If you have low iron levels without a clear reason why, if you are constantly tired, or if you have stomach upset after you eat foods that contain gluten, which are grains that have wheat, barley, and rye, then ask your doctor to be tested for this, and you should avoid gluten because that can cause negative health consequences. That being said, there are a subset of people who are sensitive to gluten. It's not going to cause negative health outcomes, but may cause a little bit of bloating, maybe a little bit of fatigue. And you can test this out by eliminating gluten. There is no test for gluten sensitivity at this time, at least that I'm aware of, that has been proven to be accurate and effective. But you can try eliminating gluten if you're somebody who deals with a lot of bloating. My worry with that is it could be hard to get enough of your daily dose of fiber. So you definitely need to make sure you're getting fiber through other sources, fruits, vegetables, nuts, and seeds. But a gluten-free diet does not mean that you are going to lose weight. It just means your diet does not have gluten in it. That's all. And then the two diets that have the most evidence for health benefits are the DASH diet and the Mediterranean diet. The DASH diet stands for Dietary Approach to Stopping Hypertension. And the Mediterranean diet is it's truly a way of life, but a way of eating that typically occurs in the Mediterranean area of the world. Both of these diets really emphasize more fruits, vegetables, nuts, seeds, fish, and poultry, and olive oils. And then they limit added sugars and high amounts of saturated fats. I highly recommend looking into DASH and or Mediterranean diets, because although they probably won't lead to weight loss, they will help improve your overall health. You may feel better, and you will decrease your chance of cardiovascular disease when you follow this style of eating. So I do recommend these diets, not for weight loss, but for health. And then overall, the worst diets to follow are fad diets, the ones that are extremely restrictive, like a cabbage soup diet. I don't really even know any of the names of them anymore, but anything that is extremely restrictive. Oh, grapefruit diet is one of them. I do not recommend these. They are diet culture at its best. They will lead to excessive hunger, likely binge eating when the diet is done. It'll negatively impact your metabolism long term. They are not setting you up for success and have a high chance of doing harm. So avoid fad diets if at all possible. And going back to the beginning, I don't necessarily recommend a diet. I mentioned the DASH and Mediterranean diet as kind of an outline, but the main things with those diets are that they decrease added sugars, especially sugar sweetened beverages, and they emphasize lean protein sources, and dietary fiber. If you focus on those things, it's not exciting, it's not sexy, but it is proven to improve your health. So I recommend following those general principles. You can track your nutrition intake for a couple of days and see where you're at as far as calories, added sugar, protein, and fiber. And if you are not reaching your goals, or if you are over consuming one of those categories, then you can talk with your obesity medicine physician, your primary care doctor, your dietitian, and get some guidance on how to slowly improve those over time. And that will set you up for long-term success from a weight management standpoint and a health standpoint. I hope you found this helpful. I hope this prevents you from doing any overly restrictive diet or falling for a marketing scam online to join a program that over promises and under delivers. The simple proven recommendations are still true today. So I hope this helps, and I'll see you next week.